I'm Larry Chu. I am a professor of anesthesiology at Stanford. I would be a frontline healthcare worker, and I'm currently working with Dr. Price on research involving masks and source control during this pandemic.
I'm Amy Price, and I'm a senior research scientist at Stanford University School of Medicine and also with the AIM Lab.
What dangers do you think are there now when all this starts reopening? So things like the hospitality industry is the main topic right now. What are the dangers with reopening that?
Well, I obviously I think the chief concern is source control, which is really containing the spread of SARS-CoV-2, the virus that causes COVID-19. In California, Santa Clara County, where Stanford is located, we were among the first, if not the first county in the United States that began asking our population to stay at home. As we begin to reopen businesses, as we begin to reopen restaurants and the service industry, obviously there's a risk that that source will now begin to spread. There's some concern that without the ability to implement widespread testing and to be able to track cases, we may find ourselves in a situation where the spread of the virus might get out of hand again. For those in the service industry, they obviously will be at risk for exposure to asymptomatic carriers. We know, for instance, that up to 40% of people may be asymptomatic carriers of the virus. So wearing a mask in public can greatly help with source control and preventing the spread. There are situations where you can't wear a mask in public, such as when you go dine in a restaurant. That is problematic because you need to eat. So those servers, the waiters and waitresses, may be at risk. There can be ways to mitigate those risks, and in California, for instance, we're implementing some of those measures. Science, I think, still needs to show whether those will be effective, such as maintaining distance, so 6 feet distance, having people eat outside, not having people eat inside, and capping the number of people at a table. That said, I think there probably needs to be more research into the type of PPE that service workers wear and how that PPE is treated or decontaminated and reused to provide them the maximum protection that they should be afforded. And I think some systems should be put in place to actually monitor and track infection among the hospitality industry. Our lab has done work on community masks for the WHO, and Dr. Price has some knowledge about this as well. Dr. Price?
Thank you. So actually, it's quite interesting because I have a family member who his manager tested positive in the hospitality industry. This particular family member is scrupulous about masks, hand washing, and social distancing. So he's been tested twice, and so far he's negative. So we're all really grateful for that. So, but it's really close to home, and I'd like to just talk a little bit about why we wear masks. The reason that we wear masks is if I wear a mask, I don't wear a mask to protect myself. I wear a mask to protect you from me. And if you are also wearing that mask, then you are it's a dual protection. So it's like the polite and moral thing to do. It's how we can help each other. And the reason that works is because when the mucus and sneezing and everything is inside you, it's in fairly large droplets when it first comes out. And when it first comes out, if it's caught by the mask and not released into the air, there's less virus there. But as that is released, let's say you just cough out and you're full of the virus. So much of that virus is going to evaporate and become airborne. And then it's going to be able to travel farther because, of course, it's lighter. It's going to have the ability to be able to infect more people. There is some research that's showing that if you wear a mask, you're going to have the spread of anything that does escape. It's a less distance. So without a mask, maybe 12 feet. With a mask, they're saying possibly 5.5. Once that is aerosolized as a virus, it can apparently last up to 30 hours if the conditions are perfect. So that's pretty frightening. So if you think the amount of people that could maybe walk past that particular virus cloud in a period of hours, it could be just one little sneeze could infect a series of people.